Hey everyone, Dr. Roces from Reddy-Care Physical Therapy, and I'm here to talk to you about core stabilization exercises. These are exercises you can do inside and outside of a PT clinic, whether you're working out or receiving therapy. I'm very big on core stabilization because I feel like it's an important part of the body. Because if your top is worked out, your bottom is worked out, I like to describe people that the middle will still be a toothpick and you have dumbbells on top. You need the whole thing to be strong. The basis of most core stabilization exercises start with the posterior pelvic tilt and breathing control. So I'll show you. First part, the posterior pelvic tilt is when you're laying in the supine position. You want to try to tuck your stomach in as tight as you can. And I describe to people, it's like that feeling you have when someone's about to hit you in your stomach and you brace up. That's the first step. The next step is rotating your hip down into the bed. And you can feel it if you put your hands behind your back. You will feel your back rotate and push into your hand. That's the posterior pelvic tilt. You tuck your stomach in, you rotate your hip back, and you try to hold that position. The next step is breathing control. Tuck it in, rotate back. If you're able to control your breathing while you're laying down, you know you're doing it correctly. And the third step that I'll show you for today is tucking your stomach in, rotating back, and doing the bridge. And if you can tell, it's a lot harder than it looks because you're trying to control all your abdominal muscles at the same time. Everyone just does a regular bridge and that's easy. But if you can train the people to do it with a posterior pelvic tilt, now you're truly doing core stabilization. Those are really important parts of all training, all workouts, not just therapy. And when you talk to patients, just tell them, you can work the top, you can work the bottom, but if the middle is still a toothpick, you're going to snap either way. You have to have everything worked out, everything needs to be strong. So if you have any questions about this, feel free to contact me for a free consultation at Reddy-Care Physical Therapy. And thank you all for watching.